those of you that still might not know me, I'm Blase Brown. I'm on the faculty at the College of Dentistry at University of Illinois in Chicago. My primary role here is in our curriculum. We do a fair amount of problem-based learning, integrating our biomedical, clinical, and social science curricula in our first 3 years. And I kind of oversee a large portion of that. And the biggest part of my role is actually coordinating facilitators, faculty facilitators, training them, recruiting them, sometimes firing them. And that has allowed me to wear many hats and interact with a number of people and aspects of our curriculum, which includes interprofessional education, and our attempts to educate our predoctoral students in the care of patients with intellectual and developmental disabilities. I have titled this "Dwell in Possibility," which is a quote from Emily Dickinson from one of her poems, "Spreading wide my narrow hands to gather paradise." The reason I chose that, for one, I love the quote, particularly when I think about myself as a healthcare provider and trying to expand what I do to include people with intellectual and developmental disabilities. But it comes from this person, who is my daughter. She is 35 years old. She has Down syndrome. That is me behind her. She's meeting one of her good friends who lives in Rome these days. And Bridget, she's one of the most amazing people I've had the privilege of knowing in my life. And I say that outside of her being my daughter. She's currently an international public speaker. She does so many different things to impact so many different people that it's quite amazing. One of her keynote speeches is titled "Dwell in Possibility." So I am borrowing that. She said I could to title this, because all of my efforts here in dental education, that in particular to changing the landscape for people with intellectual disabilities and developmental disabilities, really is looking at the possibilities and trying to share those with my fellow educators, and trying to make changes, which is a very, very slow process. Bridget is actually on a subcommittee of the United States Catholic Conference of Bishops. And she was part of a team of individuals 4 years ago that went to a conference held at the Pontifical University. It was a worldwide conference on persons with disabilities in the Catholic Church. And so not only did she get to meet the Pope, she put a YouTube together for him before we went. And in this encounter, she asked if she could bless the Pope. And the Pope actually got down on his knees, and my daughter Bridget blessed the Pope. So I think it's really important. The reason I'm spending so much time on this, if we're going to talk about education and interprofessional education and persons with intellectual and developmental disabilities, we need to show some. I do that with my students. I mean, here's one of the individuals that we're talking about and making a difference for in their lives. In dentistry, we have, these are two Commission on Dental Accreditation Standards that we would be addressing. One is about interprofessional education, which is 220, and 225 is about graduates being competent in assessing and managing the treatment of patients with special needs. You know, as far as the IPE standard, it's really about attaining competence. I'm reading this: students should have an understanding of the roles of members of the healthcare team and have educational experiences. That's a big part of it. Have educational experiences, particularly clinical experiences that involve working with other healthcare profession students and practitioners. That is a real challenge. And then with 225, Here you have patients whose medical, physical, psychological, cognitive, or social situations make it necessary to consider a wide range of assessment and care options in order to provide dental treatment. This standard for us says that our students also should have competence, not just in knowledge, but clinical experiences in treating patients with special needs. That is a very, very large challenge for us here at UIC. And these two go together. I see these two CODA standards as the perfect combination to putting them both together as a way of not just meeting the standards for dentistry, but sharing these with other healthcare colleges, because it's a very, very natural combination. What would be better than increasing the healthcare opportunities, particularly access to healthcare for persons with intellectual disabilities and developmental disabilities, as part of a team that's addressing all of their healthcare concerns. So that's where I'm starting. I have some objectives. They are, I'd like to describe, I'm going to quickly describe the current IPE and IPC initiatives at UIC, look at some of the experiences that we've had and some of the planning that's going on. And within the whole thing, I'll occasionally be mentioning some of the barriers that we've run into. Historically here at UIC, on the West Campus, we're on the West Campus of this large university. We have a steering committee. I became part of the IPE steering committee, I think about 7 years ago. And we initially had this gigantic immersion day. We would have 1,000 students in one giant hall, the UIC forum, and it was a fabulous experience. And these typically were students in middle or late part of their training program. That kind of evolved into what we have now, which is the Foundations of Interprofessional Practice, really a wonderful course. It's being offered in all of our healthcare colleges, and it's an entry-level course, so it's in the beginning of everyone's educational training to start the whole concept of IPE. Here at the College of Dentistry, we pretty much started with our participation in the immersion day, and I think I was the third faculty member to actually serve on the steering committee. We had lots of discussions. We set all kinds of goals. They were all informal. They were all kind of on a wish list. But what went along with them were a variety of barriers that we kept running into. We did some faculty development. I got involved with the director of the Nursing Simulation Center about 6 years ago and did a pilot study there that I thought we might be able to turn into an IPE experience, but that actually never came to fruition. One thing we did do early on was we were able to insert and embed a number of objectives in our problem-based learning curriculum that would at least address some of the IPE competencies, and as uniprofessional students, at least talking about things like roles and responsibilities and how oral healthcare providers would interact with the various healthcare providers in treating their own patients. The biggest challenge, I think, for dentistry, and this probably exists for many of the other programs, is we have this dense curricular structure. And in dentistry, typically there are no electives. So it's a fixed curriculum with not a lot of wiggle room. The traditional setting of a college of dentistry or of dentistry itself within the healthcare system is very singular. It has been very separated from the rest of healthcare historically, and our college and the operation of the college in terms of, say, a broader collaboration with other healthcare students has traditionally been very isolated. I wonder why that jumped like that. And we did have some calendar conflicts. We've been able to get over those somewhat. So unlike some of the other healthcare colleges on our campus, we really have non-existent electives. So one of the thoughts that we have here is to build IPE experiences within the established curricula. That would be within our established curricula here at the College of Dentistry. But it would also allow us to share experiences with some of the other healthcare colleges. And so that's kind of the direction we've been going in. Right now, I'm going to kind of go through what some of the things that we're doing here at the College of Dentistry in terms of interprofessional education and collaboration. So with our first year, our D1 cohorts, they take the foundations course. They have this problem-based learning case content, which is fairly rich. And then in that first year, they have a didactic session that they do together with some of our nutrition students. These would be students that will eventually become registered dietetic RDNs. They'd be RDNs. In the second year, we still have our problem-based learning case content. We have additional nutrition didactic sessions. Our students rotate second year, the whole cohort in various groups will rotate into a nutrition cooking lab and then share experiences with some of the RDNs and actually preparing food in the kitchen. And then somewhere in the end of that D2 year, we have a joint session with about 30 RDN students, their bachelor and master's levels, who are finishing their clinical rotations. They meet with our second year students with some of their faculty, and we have kind of a problem-based learning session together. We have an advanced standing cohort at our school. They come for 7 semesters. So these are students who are dentists or receive their dental degree in other countries. And they can actually get a DMD in 7 semesters here at UIC and then become eligible for licensure. They all take the UIC Foundations course in we call them AS2, that would be in their first year. And then moving along to the third year with the D3s, and then the advanced standing students become third year students. We have a opportunity here on campus that Mary Keene oversees in interprofessional collaborative practice in HIV care. But we're only able to have 3 students from a cohort of 122 participate in that course with about 23 other students that come from most of our healthcare colleges. In the fourth year, so those would be our DMD students in their fourth year, and then the last year for our advanced standing students, they have these community learning experiences. And essentially, they rotate out of our college every other week during that fourth year. So this goes on for 3 semesters. And we have right now, I think the number is 30 community partners. So this is a variety of health clinics, of FQHCs, and in some cases even private offices, where they really get an experience, a community-based experience, providing care to a diverse and vulnerable community, with the idea that they're going to, at least in their participation, increase access to care for these for the communities that are being served. And also kind of sensitize our students to the needs that exist outside of our college. There is great opportunity there, talking about dwelling and possibilities, both for future IPE or interprofessional collaboration in many of these centers that have more than just dental care. And in terms of trying to get to more vulnerable populations, the most vulnerable population being those with intellectual and developmental disabilities. It remains, both of those remain possibilities. They have not come to fruition yet. We also have some informal clinical settings here on site at the college. We have some advanced practice nurses who come in and work with some of our students in our clinical settings. We've hired a social worker, and we have some other social workers, students who will come in also and interact at various times with our students in clinical situations. But it's very informal. There's no assessment, and there's no real objectives that have been set for that, at least from an educational standpoint. So now I'm going to kind of change gears and look at how we're addressing, or how well or not how well we're addressing competency for our predoctoral students in treating patients with special needs. And in this case, I'm talking about patients with intellectual and developmental disabilities. We have didactics, we have varied content, you know, through our preclinical education, which I kind of have listed here. We do a very good job with aging patients, I think, and in our didactic content also with addressing patients with intellectual and developmental disabilities. When it comes to our clinical experiences, we do not do well. As a matter of fact, if I were giving a grade, I think, and I have my door closed right now, I would give us an F on this one. Yeah. And there are a lot of reasons for it. And there are a lot of reasons why it doesn't have to be like this either. But here's what we have right now. So in that community learning experiences in the 4th year, we have a couple of sites off-site. So I'm talking outside of the college right now. One is with one of our faculty members, Dr. Robert Radett. So Bob has a 0.5 appointment here at UIC. He is probably, in terms of oral health care, one of the top content experts, if you could call it that, in the United States. This is someone who really has made a difference here and in other states in training dentists about treating patients with intellectual and developmental disabilities. His office, because 60% of his private practice is actually treating patients with IDD. And so his office has become one of our community learning experience sites. And our students rotate into that site with him. And the patients coming for those rotations, they come from UCP Seguin, which is United Cerebral Palsy Seguin, an organization in Cicero, Illinois, which is not too far from Bob's office. Pre-COVID, he also does work in the OR at LaGrange Hospital, Adventist LaGrange Hospital, which is why I have that on the list here. He's also done something, Ready, Set, Smile, with the DuPage County Health Department. That has been for both practicing dentists and students, and trying to increase the number of dentists who would be opening their office to treat patients with IDD. Pre-COVID, I had created a link with Adventist Lutheran General Hospital, where they have an adult Down syndrome clinic that is in Park Ridge, Illinois. And we had students rotating there to more of kind of a healthcare situation where they would be interacting with adults with Down syndrome and their family members, and then some of the providers that were part of that clinic. So they would be family practitioners, OT, PT, and nursing. The idea there, we were trying to develop a kind of a relationship where we might have some of our predoctoral students rotate in and join with family practice residents who would be doing rounds in the Down syndrome clinic. COVID kind of put a stop to that, but we're hoping to pick that up once we get past the pandemic. And lastly, what is new is we have a new community learning experience site at Illinois Masonic, Adventist Illinois Masonic. And this is actually treating patients with IDD. And many of our fourth year predoctoral students will rotate into that. It's only a one-day experience though. So it really doesn't allow for your students to provide comprehensive care or to follow a patient with IDD for any length of time. So it is not the best situation. You look at something like this and I say, well, how sustainable is all of this? Because it seems like putting your finger in the dike to me. So we have yet to develop what I would consider a comprehensive, sustainable educational program for our predoctoral students that would actually be addressing the actual CODA competencies that we really need to meet. And from a moral standpoint, as educators, really need to do to serve our communities and those individuals with IDD that live in those communities. So we've got a long way to go. This is Bob, as I already mentioned. I think I'll just skip right through that. That's a little picture of his office there, and that's LaGrange Hospital, I believe, where he does work in the OR. He has an anesthesia permit and he has a nurse anesthetist come into the office. So he's providing care. He's able to provide care at all levels for persons with IDD. Quite impressive. There's great possibilities with the Illinois Masonic rotation. If it can get beyond one day a week, and actually get into the hospital, we might be able to link more comprehensive experiences with patients with IDD and interprofessional collaboration with the other healthcare providers who would be involved in their care. Some of the other potentials going on right now, which are new here at the College of Dentistry, we're having conversations and looking at trying to create some high fidelity simulation in the College of Nursing simulation labs in a variety of settings. And so that's something we're working on. And then I had also approached the College of Nursing, the individuals involved in their simulation lab. So that would be Dr. Sue Kilroy, with the idea of training standardized patients who actually have IDD to be standardized patients for simulation experiences for students in an IPE collaboration, looking at a person with a developmental disability. So we've had the initial discussions. I'm actually at the point where I'm writing one of the first standardized patient experiences. And then with the help of my wife, we are trying to recruit 3 or 4 individuals who we would train as standardized patients. And these would be individuals with developmental disabilities. And then create an IPE experience between nursing and dentistry initially. But we're hoping this is something that we could create for all of our healthcare providers here on the West Campus, our 7 different colleges at UIC. And then there's also the potential of creating a primary care clinic at UI Health as a way to address interprofessional collaboration. But if we're able to add individuals with IDD to that and oral health care, it certainly would complete what I would consider the circle that is needed for comprehensive healthcare, which includes oral health care and addressing the needs of individuals with developmental and intellectual disabilities. So that's another dwelling in the possibility. So in the end, this is a realistic picture of what's going on. We have a wealth of ideas and opportunities for interprofessional collaboration and interprofessional education. They're growing at a very nice rate. When it comes to treating patients with intellectual disabilities and developmental disabilities, there are challenges with oral health, as you can imagine. And so from an administrative standpoint here at the College of Dentistry, the decision has been made to try to address that by creating some kind of postdoctoral advanced training program, which we have not yet. So that would either be a general practice residency or what's known as an AGD, or advanced general dentistry, which is usually like a one-year post-graduation residency. I know that is one of the goals that our dean, Dr. Clark Stanford, has. And it would allow a little bit more specialized care with the idea that our pre-doctoral students could also rotate through those clinics and be part of treating individuals with intellectual and developmental disabilities. So that